Hi everyone, I'm Dr. Srishti and today I'll be sharing a couple of things that we always hear about a post and core and ferrule effect. I'll give you a brief introduction about myself. I'm an aesthetic and restorative dentist and I'm also a member of Royal College of Surgeons, Ireland. As we have seen a lot of times on my page, I share a lot of restorative and aesthetic cases. So today we will talk about this term that we have fancily heard in a lot of lectures theoretically as well as clinically. So what exactly is, we'll divide today's sessions into three parts. We'll briefly discuss what is post and core. We'll go ahead and discuss about where we can do post and core, where we can use it clinically. Apart from that, towards the end, we'll discuss about the ferrule effect and what is ferrule and the difference between ferrule and ferrule effect. So starting out, I'll first tell you what exactly is post and core. Clinically, a lot of times we face this scenario where we have to deal or restore badly broken down teeth or teeth with gross caries. Now in these clinical situations, we are split whether to extract the tooth or restore it. Most of the people in clinical scenarios do not want to take the risk of restoring such hopeless teeth because we know the coronal structure of the tooth cannot resist the displacement of the filling. Now this filling, if you have to retain this filling, we need to ensure that enough coronal structure is present. But as we discussed that we already are dealing with a badly broken down tooth. So what are we left with? What is the option that we are left with? This is the time when you have to opt for something, a restorative therapy called as post and core. Now post and core, when do you select a case for doing post and core? You have to see if 50% of your coronal tooth structure is present. Then you can, so a 50% or below 50% warrants you to a clinical scenario where you can place a post and core. Post is nothing but it's like creating an additional wall for your tooth that will resist the dislodgement of your filling material. Whatever your filling material is. So right now we are talking about any filling material. If you're using, so posts are of various types. You can use metal posts as well as fiber posts, prefabricated fiber posts. You can also customize your own posts and send it to the lab and get it made from the lab. But most of the times as we are practicing more of adhesive dentistry, so I'll be showing you a couple of things that I use while performing adhesive post and core procedures. So first and foremost, the criteria for case selection is that we have to choose a tooth that is either 50% or less than 50% present in the coronal half. Now you have selected your case where you're going to place a post. It's a very common restorative procedure, and for this you have to first treat the tooth with root canal therapy. Now I'm considering that you are sitting on your chair in your clinic. Root canal therapy for the said tooth is already done. The next step that we are going to do is remove the gutta percha till the apical 4 to 5 millimeter of the GP seal is left. Now you're going to remove the gutta percha from the entire canal and leave the apical 4 to 5 mm within the canal to retain your apical seal. So this is the part where your post is placed. So as you can see, this is the margin of the tooth that is already present. We have a badly broken down tooth. This is the coronal extension of the post around which you are going to wrap around your core build-up material. Core build-up material is nothing. It is going to take support from your post. So what exactly are we trying to say is, in a nutshell, the root of the remaining tooth is going to retain the post. The post is going to retain your core build-up material. So this is your core build-up material. And now this core build-up material, since this is a root canal treated tooth, it is very essential to have a crown to cover this entire assembly. So imagine if I have to give a crown on top of this core build-up material. So we are trying to retain three interfaces. First is the interface between post and the root. Second is the interface between your post as well as the core build-up material. And third is to maintain the interface between the core build-up material and your crown. Now I'll briefly discuss how we perform this in adhesive scenarios. So first of all, as you know, in an adhesive dentistry scenario, your first step has to be etching of the dentin. So I use this particular bond. It's a no rinse conditioner or a dentin conditioner. You will find it in most of your post and core kits. You need to simply apply this as per manufacturer's instructions, like for 20 seconds or 30 seconds. Let it stay on the dentine walls. It creates a rough surface within the walls, within the root canal space, and you don't really have to wash, because in case you choose a regular etchant, you need to rinse it off, and we can't ensure whether we can rinse off an etchant from the deepest part of the canal with our regular 3-way syringe. So the first step would be a no rinse conditioner. The second step would be a dual cure bonding system. So why are we choosing a dual cure bonding system? Is because that far into the canal, like say like 8 millimeters into the canal, we cannot assume that our light cure unit can penetrate the light into. So you need a bonding system which cures on its own. You need a self-curing bonding system to ensure complete curing on the dentin walls within the root canal space. The third part would be choosing choosing the correct size of the post. So I am showing you fiber posts which I regularly use in my practice. These are angelus fiber posts, and this is how it looks like. A post looks like this. So you can correspond it. You're going to insert this inside the canal and make sure you take a preoperative x-ray and make sure that you have no space between your apical gutta percha till where you have seared it off and the coronal part from where your post is starting. You're going to place the post inside, and with the help of a dual cure resin cement. So we have to really remember that everything that you're going to use for adhesive post and core procedures has to be dual cure in nature. Light cure materials will have limitations during our procedure, because the light, we don't know whether our light can reach that deep or not. So your bond has to be dual cure, your conditioner has to be no rinse conditioner, and even the cement which you are going to use to bond the post within the root canal space has to be a dual cure, flowable composite or a dual cure resin cement. You can check out any of the brands. This is Dental Avenue, but make sure that it is dual cure in nature. You want it to set on its own. Usual time to cure within the canal without the help of any external light source is about 6 to 8 minutes, and it varies from brand to brand. Now going ahead, imagine if you have inserted your post, it has reached till the level of your gutta percha. You have made sure that a little bit of your post is extending coronally, and you can use the same material, the one you have used to cement your post inside. You can use the same material to build up your core build-up, do your core build-up as well. So this portion is going to be built with the same material which you are going to use to bond the post. So this is where your cement is going to be present. And the same cement will be present to build up the filling material. So the good part is, now as you see, from here to here, we are trying to create a monoblock effect. We are trying to use materials that are similar in chemistry, so that we achieve something similar to dentin. We don't want different material interfaces. Earlier before the advent of adhesive dentistry, and even now, metal posts were being used. So the disadvantage with metal posts mostly is that metal is dissimilar to dentin, and hence the micro cracks that are created within the dentin can lead to further vertical root fractures or horizontal root fractures, which is something we as restorative dentists don't desire. Our aim is to save teeth and not send them for extraction. So right now we are trying to create a monoblock effect wherein our system of adhesion is starting from a fiber post, a dual cure resin cement, and the buildup of core, which is your filling, in dual cure resin as well. Now, in a nutshell, you have to understand post is not something that is reinforcing your root. Okay, so post is something that actually weakens your root, because we are placing a post to actually retain our core buildup, and core buildup has to be done to retain the crown. Now, in a regular tooth where more than 50% of your coronal tooth structure is present, we don't deploy this restorative therapy at all. Now, in case you are deploying a post and core therapy, you have to understand that we also have to create space to insert this post, which is called post space preparation, using post drills. Now, while we are preparing post space, we are further weakening the root dentin, and the requirement for a crown increases in post and core cases. Also, let me mention that it's always better to give single crowns in places you are doing post and core and not splinted crowns, because lateral forces lead to restorative interface failures, and this is not something we desire on an average. So now coming back to the main topic, I briefly discussed with you what is post and core. What I want you to know as well is, why do we mention about ferrule effect more often than not when we discuss about post and core? So actually, if you see this interface, this was the place where your original tooth margin was present. Now, if I build up core over this, my filling is all over this and is being retained by my post. This core buildup is being retained by my post. If I place my crown margins at the original interface of the tooth, what is going to happen is, it is going to get knocked off. It is going to get knocked off from here. And that is not something we desire, because once your crown gets knocked off, it's not just your crown that is getting disturbed. It's your marginal seal, it's your post, as well as the core buildup that you have done. Not only will it break on its own, it also will put lateral forces within the root dentin and lead to micro cracks within the root structure, and eventually you will have to opt for extraction as the final as your final treatment option. So to prevent all this knocking off the crown, knocking off of your knocking off of the core buildup, we have to create something like a ferrule. So what is ferrule? In a regular restorative condition, we make sure that we place our crown margins on sound tooth structure. Now we just discussed we are doing post and core in places where we don't have sound tooth structure. So what options are we left with? Now say this is your gum line, this is your gum line, this is your root which you want to, and this is the little bit of the tooth that is available to us above the gum line. What are your options to treat this and place the crown margins on sound tooth structure? We don't have much option. So there are two options. You have to expose more tooth, either by crown lengthening or by orthodontic extrusion. The idea is the same. Just like a regular restorative scenario, you want to place your crown margins on sound tooth structure. Whether you expose the sound tooth structure by using orthodontic forces to extrude your tooth, or you use crown lengthening, which we use most commonly, to expose more structure on which we can place the margin. So the question is again, how much tooth structure should be exposed? How much ferrule? So this margin that you are trying to place is what is called as ferrule. It is actually not a feature of post. It is not a feature of core. It is actually a margin made of metal or ceramic, whatever crown you are planning to choose. It is actually a 360-degree margin that envelopes your core around the parallel dentin walls. This is the exact definition. So to understand it, you have to visualize it like this. One second. So say we have extruded. So say we have extruded this. Has to be minimum 2 millimeter. We need a minimum margin supra gingivally of 2 millimeters. So when they ask you what is the ferrule that you need before performing a successful post and core, it's a minimum of 2 millimeters circumferentially. So you are going to place, so you are going to sear off your gada parcha here. This is your post, this is your core, and this, the margin that you are going to create around for the crown is going to be this. So the crown has to be placed on sound tooth structure. You cannot place a crown at the original interface which was present pre-operatively. You have to make sure. So I'm going to share an image with you. Have a look at this image for reference. So as you can see, it's the ferrule is exactly the margin at which the crown has been placed. So that margin is what is ferrule. And to be successfully choosing your post and core cases, you must see whether you can generate a 2 millimeter 360-degree ferrule around your preparation or not. If you have 2 millimeter of sound tooth structure all around, you will be able to successfully resist all the dislodging forces. Now, as I have already discussed ferrule, then what is ferrule effect? Ferrule and ferrule effect are two separate things. Ferrule is the 360-degree collar of metal or ceramic around your post and core. It's actually the margin at which your crown is being placed, and the crown metal or ceramic margins that cover the entire assembly of post and core. Now what is exactly ferrule effect? Ferrule effect is nothing but the hugging or the bracing effect of the margins of the crown that you have created 2 millimeter below the ferrule is what is going to brace this entire assembly or hug this assembly and keep it intact. So I hope you all understood what is ferrule effect, a brief description about how we do post and core in an adhesive dentistry scenario. Metal and other methods I have not discussed. I have not even discussed custom post fabrication. I have just discussed adhesive post and core today, ferrule and ferrule effect. Let me know in the DM how you like today's session. I'll try to keep the next session as soon as possible. I have had a lot of requests about post and core. I hope you all understood today's topic. You can let me know in the DMs for any further questions. Thanks a lot.